Here we go, folks. As we said, we're focusing this month around things to document the importance of it. We talked a little bit last month about some various areas, but we did say we'd focus a little bit on some updated standards today. So we're going to start off and talk about standard 1.4 is basically saying that informed consent is a must. So how would you, what documentation would you have, Sarah, that shows you've got that process?
Well, you need to have a policy on informed consent, which is very detailed. And it will go into the mental capacity, what to do if somebody doesn't have capacity. We'll talk about who can consent on behalf of children, understanding Gillick competence, etc. So you need to have clear understanding of that. And you also need to say that you have read and understood the policy and that you will have asked any questions. So it's no good just having the policy, you need to really understand what it's all about. And then the other piece of evidence that you could have would be a patient information leaflet, which you would send out before the patient even step foot in your clinic, telling them things like they may need to undress, they can ask any questions, they can refuse treatment at any time. So those are your two pieces really around informed consent. And then also documenting in the notes. So however you want to do it, informed consent obtained, verbal consent obtained, valid consent obtained, whatever you want to do, make sure it's in your abbreviation list and documented it every single time with the patient. Okay. And that VCO will be backed up by the fact you've got a policy and a patient information leaflet.
Yeah. And remember, you've got to keep the notes timely as well. So,
Yeah, absolutely. So you need to write them as soon as possible after you've written them. Now, I know when you have a busy clinic, that's not always possible, but try and have some protected time to write your notes. And also consider when you have your 30 or 40-minute appointments, whatever you do, that it includes 5 minutes of note writing time, and make sure that the patient knows that so that you have some protected time within your 30 minutes with the patient to actually be able to keep your write your notes up, because it is a legal requirement.
it is, and it's, as you say, because it's legal, and you can set the expectation, can't you? You know, we have to do this. It is part of the process of your treatment. So I
Yeah.
agree with that. And as well, I think the other thing that's worth documenting is you're doing an audit of them. So it's not just doing your notes audit, it's also thinking when you do an notes audit, randomly select notes from 48 hours ago or the previous week, and just check if the person attended, have the notes actually been documented and completed, so that they are completed contemporaneously and they haven't been missed, because obviously that is an issue. If you find that and you're in a team, then you actually need to manage that and work with the individual to see what is happening, because the notes, as you've said, need to be done as soon as possible. They've got to be contemporaneous, and we are aware that some systems can stay open indefinitely, so you can go back and make adjustments without it actually being recorded. So when you're notes auditing, go back and do some of these checks. And the golden rule that we're saying with all of the things around documentation is keep it short and keep it clear. And if in doubt, write it out. You won't regret having written it down if something untoward was to happen. And remember, we're here to help. If you want to look at policies, procedures, templates, or have a chat through some of the things we've discussed, then just go to our website, www.hcpg.co.uk, and book a free virtual cuppa and come and have a chat.
Yeah, and also this month we've got a notes audit as offer of our month. So
Ah,
you go onto the store and have a look at that.
yeah.
So it's on as offer of the month at this month for October.
Thank you all, and we'll see you next month. Bye.
Bye.